We're going to move along now to our next section, which is a panel discussion. I'm sort of just trying to get myself together there because I did find that quite an emotional thing to listen to. So I'm delighted to see all these lovely faces in front of me here. So this is great, and I'm going to introduce everyone. So we have a panel of experts who are coming from the field of supporting sexual violence survivors and victims. And first, I'm going to introduce Claire Galloway. And Claire is the service manager for the Rowan. And I'm just looking if we also have Sarah, but I don't see Sarah in front of me, so we don't have Sarah today. For those of you who don't know what the Rowan is the Regional Sexual Assault Referral Centre for Northern Ireland. It is a hugely valuable resource for victims of rape and sexual assault. I've actually been down to see and had a tour with Claire, and it really is a fantastic place. The service is jointly funded by the Department of Health and the Department for Public Safety and the Police Service for Northern Ireland. So it harkens back to that collaborative approach that Naomi was talking about earlier in her speech to us. The professional and highly trained team deliver a range of support services 24 hours a day, 365 days a year to children, young people, women and men who have been sexually abused, assaulted or raped, whether this has happened in the past or more recently. Also joining us today is Emma Barnwell, one of my colleagues from Nexus. So hi, Emma. Emma is the manager of the Domestic and Sexual Abuse Helpline. The helpline is managed by Nexus and provides 24/7 helpline for all victims of domestic and sexual abuse, funded by the Department of Health, Justice and Communities, another collaborative approach from within our executive. It aims to offer support and help, signposting and referral to victims, family, friends and professionals. And finally, we have two representatives from Victim Support NI, nice balance now within our panel here in our joint conference. So we have Roisin McCallion, who is an ISVA, and I'm going to tell you what an ISVA is if you don't know what that is. It's an independent sexual violence advocate, ISVA for short. And ISVAs support all victims of sexual violence, regardless of their gender, provided they're over 18. This includes non-recent and current cases, and the service provided by Victim Support is available to both those victims going through the criminal investigation or trial and those considering reporting to the police. Joining her is Fiona Robson. Fiona is a child independent sexual violence advocate, which is a CHISVA. So we've got ISVAs and CHISVAs. It took me a long time when I came into this role to understand the difference and what they meant. So a CHISVA is an independent advocate who provides practical and emotional support to children and young people aged 5 to 17 who have experienced rape, sexual abuse, sexual exploitation at any time during their life. They provide emotional and practical support and can liaise between the police, courts and other agencies acting as an advocate for the children. All of our guests on our panel this morning have a wealth of experience in supporting victims of sexual abuse and violence. Like many of us joining the conference today, their work practices and approach had to change when COVID-19 pandemic struck us a year ago almost now. I mean, that is frightening when we think about that. So I have got a few questions that we thought it might be interesting to hear from our lovely panelists. I feel like I should be on question time. I feel like I'm going to channel my inner question time person. So I'm going to maybe just ask each of you to give us a brief answer to the questions, because I think we could probably all of us talk lots about lots of these questions, because there are lots to say. So just worth us remember maybe sort of reasonably brief answers if we can, just so we can get around everybody. So my first question is, what practical steps did you take when lockdown was enforced initially back in March 2020, if you can remember that far back? And if I maybe start with Claire. Claire, do you want to give us an idea of what you guys did?
Yeah, certainly. So from the beginning of the COVID pandemic, we have continued to provide a 24/7 service face-to-face. So we are open. However, lots of our practices have changed because of the pandemic. So just prior to the lockdown, we implemented a COVID triage. So all patients are triaged for the for COVID symptoms during the medical and the admission process. And we've also provided training for all staff regarding PPE, the donning off and the donning on should it be required. So it's been a huge change in our practice, as in with everybody else. Our clinical director has worked closely with the FFLM and the Forensic Service of Northern Ireland, along with the PPS. to introduce remote swabbing as an emergency contingency should that be required. That would be for those who are too scared to attend during the pandemic, maybe they're query shielding, or that they are symptomatic of COVID or have a COVID positive diagnosis. It's only ever been used twice on 2 occasions, because we recognise that the best evidence is obtained by bringing people into our purpose-built centre. So that continues 24/7. And we also complete virtual history taking where appropriate within the Rowan to minimise the face-to-face contact. And we've tried to reduce footfall within the Rowan, as in with training and particular meetings. We would have done rolling tours throughout the Rowan, which obviously has unfortunately been cancelled because of the pandemic.
Thanks, Claire. Again, yeah, lots of changes. If we maybe talk to our Chisva and Isva, and they, Roisin and Fiona, I don't know if you have had similar experiences or if they were different, or and you might want to respond together or separately, but I'll pass across to you two.
Yeah, I think probably our experiences have been fairly similar. We kind of transitioned to working from home just before lockdown had officially been announced. And we had sort of the IT devices available to us to be able to do that. So really, it was quite a seamless transition for us. We sort of notified clients and children and young people that we were working from home, and sort of there was I guess, a bit of forward planning on our part, because obviously the nature of the conversations that we're having are quite sensitive and private. And so just making sure that we had set up a space within our homes with other people there, just that was respectful of that. We moved to that sort of online delivery, which we hadn't really used before. And that was definitely just something that we had to adjust to in terms of devising some risk assessments and like online guidance, particularly for children and young people, just about how to keep themselves safe in that environment and how we could kind of keep our staff safe as well. And then we did an increase in sort of team meetings and peer support meetings, just because we'd lost that sense of informal conversations in the office. So just in a practical sense, we increased those through using Teams online. I don't know, Roisin, if there's anything else.
No, I think you pretty much covered everything. I think what we plan to do as well, obviously I had quite a large caseload at the time. I had been off that week that we actually went under lockdown, and anytime I take some time off work, there's some kind of disaster that happens. So this one was particularly a worldwide pandemic being announced was it just tipped the scale for me. So I spent the first 2 weeks just making contact with all my current clients, just to really make sure they were okay, make sure that they were coping okay, and then to advise that we didn't have a plan just yet about how we were going to be kind of going forward, but that I would be in touch with them as soon as possible, just letting them know that I was here, that I was still working from home, that we hadn't closed and stuff like that. So it was just really making contact with people that were already on our caseloads, and then getting prepared for how we were going to deliver service going forward.
Great. So the thing is, Roisin, you've got to tell everybody when you're going on holiday, and the world.
I've told Jerry in the past, don't let me take any more time off work.
Maybe that's what we have to do. We have to keep you working on. Emma, I wonder if you want to say a little bit about the domestic and sexual abuse helpline and what action needed to be taken there.
Yeah, I suppose similar to what Fiona was saying, the two key safety of the helpline staff and the continuity of service. Because the helpline is 24/7, 365, we couldn't afford to have any kind of break in service at all. We are very fortunate in that pre-pandemic, some of the helpline staff work from home just as rote anyway. So we were very lucky in that they were able to help the transition for people who hadn't worked at home before to begin working from home. So we were quite lucky in that regard. We did also step up the staff training in terms of IT to help everybody adjust to the new interfaces and things like Zoom and things like Teams that people hadn't necessarily used before. And we also in the spring of last year launched a recruitment service for new volunteers to help support the helpline staff. But I would have to say we were very lucky in that there was no break, everything carried on without any kind of massive disruptions to services at all.
Great. And I mean, I will say that, you know, Nexus in its counselling side of things also went immediately to telephone counselling, and our counsellors were incredible in the way that they stepped into that space and ensured that the clients' needs were put to the front. And I think that's what strikes me about the responses from everyone. It was that desire not to have a break in service for those people who needed us most. So I suppose one of the other questions, one of the other thoughts is, I know that certainly hearing about the NHS frontline staff, and we hear about the sort of the exhaustion that they're facing, and you know the difficulties that they've faced into as teams. I think we see that in our own work as well. I think with our staff, you know, and how our staff and volunteers who've worked through the pandemic, which most of us probably have. So just thinking a little bit about that in terms of, you know, obviously you've all talked a little bit about how you change things operationally, but Claire, was there anything you needed to do for your staff really to try and help them come through? And I think probably as we've gone through the various waves, you know, I think, I don't know what, but I think this has been one of the tougher ones this time around again. But have you done anything or introduced anything to try and help support your staff?
Well, because we work on a trust, because we work within the Northern Trust, we have a great support mechanism. So we have psychology through occupational health. Our staff can refer into occupational health at any time. We have support mechanisms built within the Rowan. I would say that the main difficulty was maintaining the staff morale through the pandemic. We're very aware of that, both on the medical side and the nursing side. So again, our clinical director, Professor Hull, and myself and the lead nurse have been there supporting the team's open door policy. If they're struggling at any time, you know, to come and see what situations we have adapted our working time. We can't work from home, so everybody is in the building covering the 24/7. So again, it's just normal for us, only the procedures just take slightly longer with all the infection control measures.
Yeah, no, that's great. And Roisin and Fiona, I mean, I think Fiona, you touched a little bit on it, you know, going remotely, staff meetings and things. Was there things that you thought that you did in order to try and support staff? I think it was very difficult because I think we're trying to do things really on the run with this, but was there anything that you particularly did?
Just to echo what Claire was saying, although Claire was, obviously they were still working from their usual base, we had all moved to, you know, working from home, and we were a lot more remote. So the open door policy from our line manager in particular was, you know, was fantastic. We had regular check-ins, probably more than once a week, you know, just to make sure that we were all doing okay. Victim support did start a monthly newsletter, which just helped everybody keep in touch, and there was kind of fun activities on that you could do. You could enter quizzes, you could do you know, different things just to keep the morale and the spirits up. People were sharing pictures of what they were doing during lockdown and stuff like that. And then obviously our clinical supervision, which my clinical supervisor is Trevor from Nexus, so he had a very much open door policy as well, and he got phone calls from me at different times, you know, even if I wasn't struggling with my work, if I was struggling with something personal. So it was just having that support network available, which was fantastic. You know, it really did help through those initial months. And as you said there, Brenda, this last kind of lockdown has been much more difficult than any of the others. So the support has remained the same throughout.
And I would say we have noticed a difference in our activity. It's significantly dropped during the first phase. So our attendances would have been down about 45%. So we've seen a reduction compared with the previous year. Again, with staff challenges, we had one nurse, our lead nurse, was redeployed to ICU. She had previous ICU experience, so volunteered, felt that it was the right thing to do, to go to ICU, and some of our nurses, on-call nurses, have also been redeployed from their substantive posts. So it has had a knock-on effect, and then also 4 doctors and 5 nurses have had periods of self-isolation. So, you know, there has been an impact, but meanwhile we are maintaining, we have managed to cover 100% 24/7 cover for both the doctors and nurses throughout the pandemic.
Great, thanks Claire. So Emma, any thoughts from you on this one?
One of the first things that we did was it became increasingly apparent, not that far into the initial lockdown back in last March, that the calls that the helpline operators were answering were becoming increasingly more complex. people were presenting with high levels of anxiety, presenting as hyper aroused, very, very frightened, on top of the situation that they were already experiencing. So we arranged training for the staff to help them better answer those phone calls. But I would say we are very lucky in that, again, pre-pandemic, there are 2 sets of teams that support the helpline staff and who very much operate on an open door policy. So the management team that I'm part of are always there to support the staff. And then, as Roisin has said, our clinical team provide 24/7 support to any helpline operator and are very much encouraged to call them for anything, both whether it's a practical question about maybe something they've come across in a phone call, or just to vent, or just to talk through their feelings, or talk about something that they're struggling with. So that was really doubled down on. We really were very making sure that we were very clear in reinforcing that message to the helpline operators that no matter what time, day or night, help and support was always there for them.
Oh, that's great. And I think, you both, I think Roisin and Claire have touched on this, that, and Emma too, that it's not just the work that people are trying to deal with. People are trying to deal with things that are way outside of that. I don't envy anybody who's got school age children right now. I'm so glad my children are young adult people and they don't need any homeschooling, because I think there's all kinds of pressures and difficulties, and as we acknowledge, our funders do require us to keep delivering. So as organizations, we're under that kind of pressure, and it's been a very, very difficult time. So I think we all know how difficult it is, but one of the kind of things I thought might be interesting for us to explore is, what is it they say? It's an ill wind that blows no good. So, have there been some benefits? Has there been some changes in the way that we operate, the way that we practice? Some things we've tried out because our hands were forced during the pandemic, that actually maybe were good things, are in the long run will actually be of benefit to our clients and to our organizations. So, I know this is me sort of trying to find the silver lining, but I do think it has forced us to think differently, and sometimes that's not always a bad thing. So, Claire, any thoughts on some of the upsides, the things that you've benefited from, or things that you might want to take on that have been good positives coming out of it?
First of all, I suppose in terms of the pandemic and the challenges, it's really highlighted to us yet again what a fantastic team we have, how resilient they have been, how adaptable they have been. One of the benefits to us was the enabling rapid adoption of technology. Working within a trust and working with certain ICT systems, we have to jump through a lot of hoops before we can change the ways that we work. Whereas because of the pandemic, there were definitely technologies that were pushed through that has really helped the Rowan and onward referrals and transfer of secure and confidential information. So I would say that has been one of the key benefits. Also, we have received some positive feedback regarding the virtual history taken. So when a client comes in to the Rowan, to reduce the face-to-face time, they can also do their consultation via an iPhone faced with the doctor. Now, some of the patients have fed back to say that they felt a wee bit more relaxed, being in the room with their family member, but transferring their information via FaceTime. And they have really, felt as though they were allowed more time or was able to think more clearly and take a few minutes extra time while they were given their account over to the forensic medical doctor.
Well, that's good. That's great. As I say, sometimes we have to find those moments of light, and so it has been quite dark. So Roisin and Fiona, anything that you think you guys have learned through this that has become a good thing, a benefit, something maybe you've altered in your practice?
Probably just echoing what Claire said. Definitely the use of technology that we'd all been using at home, probably for many, many years, but we hadn't got to that stage in our practice where we're using it. And I definitely think that's something that will probably continue, God willing, after lockdown, but also just the accessibility that allows for some of our young people or some of Roisin and Lucy's clients. There's so many barriers to people coming into a building, an unfamiliar building, and so I just think being able to click into a face-to-face with someone has definitely sort of reduced a lot of those barriers around travel and finances and just the anxiety of going somewhere that's a bit unfamiliar. And like Claire said, you know, people being able to be in their safe space, hopefully at home or wherever they feel safe, being able to have those conversations, really, I think it's a real benefit of using that technology. Probably in some ways how I've been more efficient, probably working at home, because you don't have the office chit chat that you normally have. You know, you do miss that, but in some ways it probably has increased efficiency, which is something maybe to take into like the future, in terms of maybe allowing flexibility for staff to work from home or whatever. But also then just it eliminates that travel time between meetings and things. So you can sort of book in a day or a few more sessions with people. I'm not sure, Roisin, have you any other ideas?
Yeah, just probably just covering, you've covered most there, Fiona. For me, because I covered such a large portion of Northern Ireland, I spent maybe 10 or 12 hours a week just driving alone. So getting that time back has allowed me more time. I've been able to kind of increase my caseload slightly as well. So, you know, definitely working more efficiently and being able to get more work done when you take away the travel time. We have seen a notable increase as well in clients turning up for appointments, even though they are virtual appointments. So, you know, it's something that we need to look at in the future. Like, you know, is that initial face-to-face appointment too daunting for someone? You know, is it better to form a relationship first of all, either via video conference or over the phone, and then invite them back into face-to-face engagement when they feel comfortable? Because before lockdown, I mean, we would have maybe had, well, I personally would have maybe had 1 or 2 no-shows every month, and I've seen a huge drop in that, you know, since we went into this kind of lockdown period. So it's something that we need to obviously look at in the future.
Great, thank you. And Emma, I saw you left us, but you came back, so I'm very glad you're back. You're just still on, yeah, great, you're off mute now. So just in case, what in your travels in space there and time, if you've forgotten what we were asking, we're just checking if there's any benefits that you have felt and the helpline has felt because of the pandemic.
Just a minor panic there because the sound cut out on me, but I tried the tried and tested IT trick of switching it off and switching it back on again, and that worked. Okay. Anything above and beyond that is beyond me. So for us, I think probably one of the biggest benefits has been there is a new level of connectivity between everybody in the team. As I mentioned before, the team was North Ireland wide, and some work from home and some used to work in our old Londonderry office, and obviously some worked in the Belfast office. But now that everybody has moved to working from home, there's a much bigger crossover in people that wouldn't necessarily have seen or met each other. And that's great. And it's fostered a really, really good dynamic within the team. And obviously we've had to make alliances and make flexible working arrangements because, as you say, anybody with school-aged children right now has had to endure a massive amount of change in the past year. And the team have been excellent and have been wonderful in stepping up and providing that flexibility and helping to provide cover, for example, for shifts and things like that. And one of the other things as well is it's given us a really good scope to enhance all of our referral processes and reach out to our partner agencies across Northern Ireland. Initially in the initial stages, just to update them with where we were, but it's continued on, and it's a piece of work that we're always working on, is strengthening those ties as well with everybody else, because we're all very much in the same situation.
Great. That's great. And I will say, just to echo, I think what Roisin and Fiona were saying about the change in cancellations. I know within our counselling team that there was a drop in the sort of did not attends and cancellations, and some people were saying that it removed that barrier, as you say, that barrier of physically having to get in your car and drive to where you're going to go and get out and get involved. But I mean, I will say, as a CEO of an organisation, whilst I think it's great that we've been able to utilise and harness technology, and I think there will be a point that we won't go exactly back, but I do think there is a synergy that happens when you get a group of people together in a room, even with a cup of coffee, and the conversations that happen spontaneously that we're missing. And I think there is an element where I wouldn't want it to be all remote all the time, forever and ever. So speaking of which, my last question to the panel before we see if there's any questions from participants out there, is obviously we hope that we eventually go back to, I'm going to do the bunny ears, normal. I mean, I don't think any of us quite know what that's going to look like at this stage, but do we think that will we go back to normal? Do we have any thoughts about how we kind of come out of where we are right now? Claire, have you guys started thinking about or is there a new normal? Is this the new normal maybe now? I don't know.
I think at the moment it's just getting through this third phase. We had a rolling management group there just on Friday, and we have been looking towards the future, as in a new communication strategy and looking at different ways of how we're working. Professor Hull, our clinical director, is also currently leading on a piece of research via the University of Ulster on the impact of the pandemic in SARCs in the UK and throughout the Republic of Ireland as well. So that'll be really exciting to see what the activity has been through all the SARCs. So we'll look forward to that. Again, we're all participating in that piece of research throughout all the SARC units. The key learning for us, I suppose, is that although activity has been reduced, sexual violence has not gone away. So, you know, we need to think about how we can re-engage again, and we welcome the Minister of Justice comments today about our focus on sexual violence as well. So that's we're very grateful for that. And as we all know, there has been a need increased for funding for counselling and as support. Every year we like to promote that there's more counselling needed and support. But we very much welcome the introduction of the ISVAs with the Minister of Justice disclosing that today. So that's another piece of good news. And we hope to continue and utilise the new technology. And we would like to recommence our service user group once we try to get things back to normal again. I don't know what the new normal will be, but again, I have to say that the team has been resilient, and we just have to adapt and change as we go forward, Brenda.
Yeah, no, I hear you there, Claire. I know if any of us had a crystal ball this time last year, would we ever have predicted in February 2020 where we would be sitting in February 2021? I don't think so.
Yeah, I would say that just from a victim's point of view, I think there's a slight worry about the backlog of the criminal cases and the anxiety that that's putting on victims. So again, that would be one of the key areas that I suppose we would try to support, and the victims always come first. So that's another piece of work that has to be looked at as well.
Oh, great, thanks, Claire. So over to Roisin and Fiona. Anything about your new normal? Anything you want to add in there?
Just really to follow on what Claire said. I mean, I have a massive amount of clients that are still waiting for their criminal justice case to conclude, just due to the backlog, because of the courts closing for such a long period of time last year. So I think we need to really look at that in the future, and establish some other method of working should we find ourselves in a similar situation again. As a team, I think what we're going to do is try and track and record our achievements, just to say, I think there's no harm in looking at how well you've done and being able to adapt to something that was just so unpredictable. So that's something that we're going to do first and foremost, and then be able to look back and reflect and see what we could do better, and have a contingency plan if I ever decide to take a fortnight off work again.
It's the world's going to get together and vote no. What happens? Emma, have you any thoughts on what the new normal for the helpline?
The new normal will look something sort of similar to where we are at the minute, in that we will just carry on no matter where the helpline staff are based, and they're always going to be there for victims of domestic and sexual violence and abuse. The new normal for us, I suppose, is our new offices that we're moving to on the Malone Road. So whenever we manage to all gather together in one room or one building, it'll be interesting to meet most of my colleagues, because I haven't met most of them yet, just because I began this job during lockdown. And I think what we'll do is similar to what Roisin was saying, we'll take forward the learnings that we've learned during this, and also the work that we've done. We've done a lot of really brilliant work in awareness raising campaigns. We've reached out to, for example, SPARs across all of Northern Ireland to display our posters, and regardless of when lockdown is lifted, that work is still being done. Those posters are still there, that awareness has still been raised, and we will continue on with that, with this bank of work that has been done. And what we know is that with every lockdown, it became quite a predictable pattern in that the phone calls would diminish quite rapidly and quite quickly, but emails and web chats would match up to meet them. So the service is still very much needed. It's always there. And, as Claire has very rightly said, just because we're in lockdown and in a pandemic, it doesn't mean that any of this has gone away. So the support and services are still always there to help people.
Yeah. No, absolutely. And I think, from a Nexus wider point of view, I think I keep referring to the idea of a hybrid service. I think things will never be quite the way they were pre-pandemic, I think, for any of us, because I think traveling will be getting reduced. The idea of meetings, traveling an hour to meet one individual and then traveling all the way back is probably maybe going to be a thing of the past now, where I think the Zoom meetings and the other meetings will become more normal. And we will probably adapt and change. I think you're right, Claire. If we had a crystal ball and could see into the future, that would be great. But unfortunately, we have to just adapt and change. And I do think, before I check if there's any other questions coming in with Louise, I do think this is a moment, and I'm going to steal it for just a second to say how amazing the staff teams across the organisations that I have been speaking to, our own victim support, MAP, Rowan, all of the organisations who have Women's Aid, all of the organisations who've had to get together and come through this and maintain victims and survivors at the heart of what they do, and have done that, have really done that. It wasn't just rhetoric, it has been shown over and over for a year, 12 months of people adapting, changing, shifting, moving very rapidly at times. That I think there should be great pride in that, because whilst our colleagues in the NHS have been tackling the physical part of the pandemic, I think organisations like ours have been tackling the trauma and the emotional side and the counselling and the things that still need to keep happening on the other side of it. So huge pride in my own team and the team within Nexus, but also, real accolades across the sector, because I've talked to people and I've heard what people have done, and it has been incredible. So just going to steal that minute while I've got this platform, and there's 200 and odd people listening to me. So much kudos to the teams across the voluntary and community sector. So Louise, I'm just going to ask you now if there are any additional questions that you wanted to bring in.
Hello. Yes, we have had quite a few questions in. I'm going to start off because there were some people asked some direct questions about support, and I just wanted to put it out there. If you need support of any kind today, you can email help@dsahelpline.org, and if you pop your wee phone number in there, someone will give you a call back today. Also, generally, if you've been affected by any of the issues that have been spoken about so far today, the helpline number is 0808 802 1414. And we also had someone asking specifically about support around court processes, and that's Roisin is one of our ISVAs, and the ISVA's job is to provide that specialist support for victims of sexual assault and sexual offences as they make their way through the criminal justice process. So, if you get in touch with us at Victim Support NI, we can hopefully put you in touch with the ISVAs and get support there. More generally, we have a lot of love in for everyone who's keeping things going during the pandemic, congratulating people on keeping the service going, keeping the support going out there, and that they've adapted to the new normal. We had a question of is there anything that ISVAs and CHISVAs can't do when they're not delivering face-to-face? Just interested in how that works.
Well, yeah, I mean, one of the biggest challenges for me was, being able to go to parts of the process with clients. So the likes of their police interviews or their ABEs, and support clients through that. So that for me at the start of, well, still is actually, I was going to say at the start of the lockdown, but it still is, kind of letting the client go and fly their own nest on their own without having that support person there. has been a struggle, because obviously it's such a huge process that they're going to do, especially the police interview. It's probably the biggest part of the process for any victim of crime to go and tell in such detail what has happened to them. Part of the ISVA service is to attend that with the individual. Obviously we won't be in the room with them while they're giving their evidence, but we'll be available outside if they need to have a 5-minute breather or a break. So yeah, there has been some elements of service that we haven't been able to provide, but we've just had to step it up in other ways. So being on the other end of the phone before and afterwards, or even during those breaks. So it's just about trying to think on your feet with those things and be more readily available. Yeah, there's been a few things, definitely.
Thank you, Roisin. And we also have a question in about, we heard from Minister Long earlier, who was talking about quite an extensive range of reforms that are ongoing at the moment. And the question for the panel, for anyone who wants to answer, is, do you see the future getting better for victims and survivors of sexual violence and abuse, given these reforms that are coming in? Just a wee question.
I'm going to start off, and I suspect Claire may have something she might want to add in there as well. I'm sure everyone does, but I would say that each of these steps is about shrinking the change. It's about trying to reduce this huge piece of work that we are all engaged in doing, and every step that begins to shrink what needs to be done has got to be welcomed as a positive step. There will never be, I doubt if we're ever going to get a time when we've got it exactly where we need things to be, but I think all of these are positive and to be welcomed. And that, what Minister Long talked about collaboration, it's something that is so important. No one agency has the secret to fixing and sorting these things out and making it better for victims and survivors. We all have our part to play in that. And as Winnie Lee talked about earlier on, even those of us who someone speaks to informally, outside of any professional capacity any of us may have, we all have a part to play. So I think they're a step towards, I think is what I would say, and we should welcome them as such.
Yeah, I agree, Brenda. I would say that we really welcome the Gillen recommendations, and we really welcome the introduction of the ISVAs, especially for those who are unsure whether they're going to proceed or not. So, you know, we are hopeful and hoping that attrition rates will go up with the introduction of the new ISVAs. So that's a very good start for us in terms of support for the victims. Going forward, I agree, total collaboration is required. And I think there's lots more work to do, especially in the paediatric side and the children's side. So no, look forward to the future and the recommendations being rolled out.
We've had a further question in from Helen from the organisation Reclaim the Agenda. She's asked that being in lockdown has not stopped people from abusing women, and lots of things have moved online. Have any of you in your practice noticed abuse increasing online, and how do we combat this and support survivors? So just a question about online abuse there, and whether you've seen any spike in it, you know, whether and is there anything in particular that we can do?
I think for us it was something that we were very mindful of, you know, especially because we were moving towards a realm of supporting people online. We were very mindful of the fact that it may have been triggering for people to have to engage with us through those medias and through those platforms. In terms of an increase in online crime, I can't say that I have noticed it, particularly in my over 18 clients. You know, we've definitely seen, for me, the most stark increase has been in domestic situations of sexual abuse and sexual violence. And then also we've seen a huge increase in people reporting historical crimes. I don't know the science behind that, you know, whether people have had obviously less distraction, more time at home to think about things, you know, more stresses on their own mental health. Now, particularly, I know it's something that we would speak about quite often with the whole team in terms of the under 18s. So Fiona, I don't know if you have noticed an increase in online abuse with under 18s now that the social engagement isn't there as much. It could be a possibility for the younger generation.
Yeah, I guess, you know, our project's been kind of up and running for a year, so it's hard to kind of say to compare pre and post lockdown or pandemic. But there's, you know, particularly in the under 18s range, there's a high prevalence of online abuse and online crime in that area. And I think probably the ramifications of this over the next couple of years as well, you know, as young people, the activity that's happened during this time might not be disclosed right now, but it could be something that is disclosed further down the line, and it'll probably take a few years even to see what the effects of this has really been on young people. But yeah, I would certainly say, you know, all of us have been more active online, and so I imagine it's inevitable that there will be sort of more use of that platform. Yeah.
And just to let you know that the same person who asked the question also made a comment that you're all phenomenal women doing phenomenal work, and that the theme this year for International Women's Day 2021, which is going ahead, albeit on a virtual platform, is the new phenomenal. So I think you very much feed into that and are part of it. And thanks to Helen for that comment. We do have a couple more, if we can squeeze a couple more in the last 2 minutes that we have. There was a question about ISVAs and CHISVAs or a similar kind of advocate or support role. Would it be necessary to have something along those lines attached to schools and universities?
Yes, is the short answer, definitely. There are some staff working in universities that I know do engage with the pupils there, but I think something more bespoke and something a lot more independent would be fantastic. We've tried to do some work with the universities over the last few years, just to promote awareness and promote knowledge and stuff, which did go fantastically. And we are often approached by university students who are very interested in our roles and looking to do kind of research pieces and stuff like that. So I think obviously once we get out the other end of this and we have more time, it has always been a piece of work that I've been wanting to do. And then obviously with the Minister's announcement today that we are hopefully expanding the advocacy service within Northern Ireland this year, there will be more feet on the ground. Basically, it's a hard job to do and to cover all areas whenever there are only 2 full-time ISVAs and 2 part-time CHISVAs providing this type of work. So as soon as we have more people available, we will be hopefully covering all corners. So yeah, it would be yes is the short answer to the question, and it would be fantastic to have people available to pupils at schools and universities.
Thanks, everyone. I suppose that's just about the time we have. But before I pass back over to Brenda, just 2 comments. We have one survivor who has noted that they are forever grateful to the lovely lady on the domestic and sexual abuse helpline who they first disclosed to. And thank you so much for helping start off on the journey of recovery. I think, you know, like comments like that make us, you know, realize this is why we do what we do. This is all about victims and survivors. And we had a practical question in about the recordings and resources. And just to answer your question, recordings will hopefully be available and resources from the conference afterwards. And they're just subject to getting consent from speakers, and we will send out what we have and what we can in due course over the next few days. So hopefully anything that you missed or anything that you want to share the learning, share the conversations, you can do that. Because obviously, yes, there are currently almost 300 people on today, but obviously for us to make that real difference, we need to be sharing this to thousands of people so that we are all upskilled and we are all working together and pushing in the same direction. So thank you everyone for your questions. Brenda, back to you.